Hey everyone. Hello, hello. It is Thursday, January 24th, and I'm Angela McGowan, your professional healthcare advocate, caregiver strategist, and founder and CEO of Angie's Pace. That's patient advocates committed to excellence. So I'm going to ask you to do what I'm doing right now, and that is to share the broadcast. Of course, as always, I say if you'd like to use this platform, you can download it, bit.ly/stream for you. And then the next thing I'd ask you to do is to join me live so that we could you could be a part of this discussion, which is so big, and it seems to be getting bigger by the day. So I'm going to give me a minute to share, and I'm asking you to share as well. This is something that everybody needs to actually be aware of. And I'm telling you, sometimes spell check doesn't help you as much as you think it does. Because it's changing my abbreviations. So thank you very much for sharing and for being part of this broadcast. So yes, I'm Angela McGowan, and I'm the author and publisher of How to Get Out of the Hospital Alive. And I told you for the last few days we've been talking about it. It's not even about getting out of the hospital. It's about making sure that you don't have to go into the hospital. So you can get this. $12.99 is the sale price at bit.ly/to get out alive 1220. All right, so let's just jump right into it. As I put up, and let me just make sure I have that part, that we are 24 days, January 24th, 24 days into 2019. And we now have our three blood pressure medications have been recalled, right? 2 of them in less than 7 days. So here's the question. Are your blood pressure meds safe? Simple question. Are your blood pressure meds safe? So according to the Food Drug Administration, no. I would say thousands, hundreds of thousands of people have either already taken or at this point still taking medications that have traces of NDEA. As I said, that is equivalent to what we were talking about in food, MSG. This is a cancer-causing product that has traces, they say. Now, they said there was always going to be a little trace, but this is more than it is allowed. There's more than is allowed. Now, 2 days ago on Tuesday when I was talking about this, that pharmaceutical company was like, don't stop taking your meds, check with your doctor. But today, the announcement was stop taking them, call your doctor's office right away. You need to get a new prescription. And I thought that was, as I said, I was appalled about the whole thing about don't stop taking it. Because what I want you to understand and what I understand is before they made this announcement, if you're taking blood pressure medicine, you have a very, very high chance that you've already taken this, and you might have been taking it for some time. And the reason I'm bringing this to the forefront is now you can get a 3-month supply of most of your medications. So imagine that lot. Now, unlike someone who might go and get theirs every month, you might have all of yours were filled from a lot that is now being recalled. That is a serious situation. Blood pressure medicine is something that so many millions of Americans, and I say people around the world, are taking. And now they're saying that In 24 days, 3 more lots, which represents thousands and thousands of pills, are being recalled. So this is what's in USA Today. It said on January 2nd, they put out a notice. More blood pressure medication recalled. Company recalls 80 lots of Valsartan over cancer concerns. January 7th, more blood pressure medication recalled over carcinogen concerns, this time losartan. And then January 23rd, blood pressure medication recall over cancer risks expanded for more losartan drug. I'm telling you, this recall has been going on since July 2018. So as I've been texting people and calling people and asking them about most that I know take blood pressure medicine or maybe have family relatives, these are the questions I'm asking, and you'll be surprised at the responses. So the first question I ask, do you take blood pressure meds or is someone in your family? Yes. Did you hear about the blood pressure recall? Listen, in 2018. Yeah, I heard something about it. Did you ever call your doctor about it? No. Have you refilled your blood pressure medications in the last 90 days? That would take them back to 2018. Yes. So I wanted to tell you, I'm calling to tell you, I'm texting you and calling you to say that now there are 3 more medications that have been recalled. I think when I was talking to them yesterday, it was 2. So today, the ones I called was 3. Do you think you should go and see the pharmacist? Take your meds with you. Yes. I said, will you go immediately? Now, this is the answer. Some people said, yeah. And some people said, well, I'm going to go soon, like, before the end of the week, which, as far as I'm concerned, represents tomorrow. But anyway, I was just saying, I don't take blood pressure medicine. I'm thankful to God. But, the bottom line is blood pressure medicine is here to help us, not to send us into another condition, not to give us another illness or disease. We're already fighting something if that's what you're taking. And this, ladies and gentlemen, this is why this book exists. This is why. What up here, what you don't know could kill you. It's the information. How to get out of the hospital alive is not to go in the first place. That's the point. That's what this is about. This book teaches you how to develop into a powerful patient. And so I've been talking about the Powerful Patient Movement that started this year. It's a free group, a Facebook group, bit.ly/Powerful Patient Movement. Ladies and gentlemen, there is never more a critical time or an absolute time that you need to belong to this group and learn to develop into a powerful patient. Absolutely. Let me read you what was in today about these medications. The Food and Drug Administration has recalled another blood pressure medication because of the detection of trace amounts of NDEA. Torrent Pharmaceuticals Limited's that's their company name, losartan, potassium tablets, USP, and losartan potassium and hydrochloride tablets, USP, that's probably United States produced. All the products that have been recalled by the company because of the cancer-causing chemical in that drug. Some of the blood pressure medications recalled now it's been going on since July, but here's some more they brought just since November of 2018, have been recalled by the Princeton Pharmaceuticals, Princeton, They've been called Teva Pharmaceuticals. I mentioned them before. They have a call. And then now we have the Torrent Pharmaceuticals. But there are quite a few of the pharmaceutical companies that have large lots, thousands and thousands of pills. The ingredient that is of concern is the NDEA. You can go to the website of the Food and Drug Administration, which is www.fda.com. But I'm asking you to go to the pharmacy and get your blood pressure medicine verified for safety. Take all of your medications that are there for blood pressure, whatever they may be called, whoever made them, whenever you got them, and make sure that that is checked. That lot has not been recalled. That pharmaceutical, your pharmacist is well aware of it. Your doctor may know the brand or the manufacturer. Maybe they know that they've been recalled, but your doctor cannot say with certainty that where you filled your prescription, that lot is what you have now or is not. You have to go to the pharmacist. At the Powerful Patient Movement, this is our message. Y-Power. Your providers owe you wisdom, ethics, and respect. That's our message. Y-Power. Your providers owe you wisdom, ethics, respect. So your providers are your physicians, your pharmaceutical companies. They're providing you medication. The pharmacy, okay, imaging, wherever you are getting services that are directly in conjunction with medically, or if it's non-medical, if it's part of your medical care, your medical team, they owe you wisdom, what they know, ethics, doing things the right way, and respect. Respect the fact that you made a mistake and get these pills away from me. Stop producing that. You see what's going on, because I know that this is not just like they just found it out 2 days before they reported it. Because this is the FDA, which often samples all of these medications. And can you imagine, are you thinking about the thousands of pills they sampled before they said and issued the recall? It had to be substantial and consistent. So I'm concerned about you and everyone that is taking any kind of medication, but definitely if you're taking blood pressure medicine and the recalls have been going out since July of 2018, and we are in January of 2019, and we have 3 that have come out in 24 days. 24 days. And you are going to say to me that there is no need for you to be what? A powerful patient. There is absolutely a need for you to be part of the Powerful Patient Movement and to spread this message of Y-Power. You need to share this broadcast. You need to come into the Powerful Patient Movement. First thing you do is take your medication to the pharmacy. You know, I started actually on Tuesday talking about the 10-day self-love challenge. And what we're talking about, the first thing I said we're going to show self-love is to go and to make an appointment, keep the appointment for a complete physical. Because all of these different medicines, you don't know what other traces, what other things are going on in your body. But the only way you're going to know is to go to the doctor and have these tests. Have a full physical. And then yesterday I said self-love was taking your meds in. At that time, it was only 2 this year, which is 2 too many. But just in one day, the development is there's 3. And the Food and Drug Administration is saying, yes, there's a problem. And you need to go and now don't just go and throw your pills away and say, that's not what we're talking about. That is not self-love. Self-love is taking the medications to the pharmacy and getting a replacement if needed. But I think we're going to add a few different twists on self-love. I think today we're talking about writing 3 good things about yourself. I want to put on there self-love is taking your meds to the pharmacy to get checked. And then another part of self-love is taking your medications as prescribed. Stop. Let me say it again. STOB. Practicing medicine without a license. And then let me call your attention to the fact that your physician is doing just that, practicing. And so that is why it's up to us to become powerful patients that, hey, their practice will not be in vain on us, because we are not just going to be asking questions. No, powerful patients ask the right questions. Absolutely. So when you go to bed tonight, you should be able to say to yourself this question in the affirmative. Are your blood pressure meds safe? You should be able to say, absolutely. Mine are safe. My husband's are safe. My mother's is safe. Father, look, I'm calling everybody. I'm texting everybody. I'm making sure that tonight the blood pressure medicines are safe. Most of your pharmacies are open 24 hours. Some of them are closed between 7, 8, or 9. But regardless, get those pills to the pharmacy and find out about that a lot if your lot has been recalled, especially if you have refilled your pills in the last 90 days, or if you have a 3-month supply as well. Because this recall has been going on since July of 2018. That means we are in the 6-month mark. And we have this month added 3 more medications. All right, so I'm thanking you for joining me. I'm thanking you in advance for adhering to this about going to check on your blood pressure medicines. Thank you for sharing, telling everyone. And I'm also thanking you in advance from stop being the doctor's patient and come and be and develop into a powerful patient. And I definitely want you to understand what our message is in the Powerful Patient Movement. Your providers owe wisdom, ethics, and respect. That is why power, and you absolutely have it. Come and be a part of the Powerful Patient Movement. I'm Angela McGowan, your professional healthcare advocate, caregiver strategist. I'm the founder and CEO of Angie's Pace, and we are very happy to serve you. If not only with the blood pressure medicine, with being a liaison between you and your physician. If there's some questions you need to contact me, please talk to me about a free results call. I'm available. You could go to bit.ly/advocate Angie, and fill out the information, and I will be sure to contact you. So in parting, you know what I'm always saying, blessings and joy, they belong to you. Have a great one, everybody. Talk to you again tomorrow. Bye.